How do you help your volunteers participate in a fair? You may want to encourage them to attend another fair. You may also offer a pre-draw for your volunteers, but in order to do so, you have to coordinate with client services, Melody or Zolly, or let your liaison know. And the sites that offer pre-draws, mostly this happens in the statewide area, we have to have a guarantee of 50 or more participants in order for Quest to be able to pick up and process the blood. So again, talk to your liaison and client services about coordinating that. You can also open early for your volunteers if you'd like, or you can rotate the volunteers in and out of the screening lines, the blood draw lines. Just make sure that all the screenings are still covered and that they're not jumping the line in front of participants. No participant would like to see that. So make sure they're flowing in with that line. And if you have any ideas or suggestions, let your liaison know and we'll try to help you figure it out. We are also continuing our friends and family discount. You'll want to share the online discount code, my first 9HF, again, not case sensitive. And this is for anyone who has never attended a 9Health fair. And they will also receive 20% off the health screenings when they register online. We also have 2 more new discount packages, and we're going to talk about that on the next few slides.
Okay, so these package discounts, and these are just guaranteed in 2020. There's no guarantee that we would do these in years to come. You may see, us take a break in package discounts, or we may have brand new ones. So just focus on these for 2020. Participants will receive these package passes, we're calling them, and we'll show you a visual of what they look like in the next slide. Each package pass is worth $10 off the different blood screening packages. So we'll go into what those packages include. If they pick the baseline health package, that includes the blood chemistry, and you guys know Kimberly can explain more about the blood chemistry. It's I think as she puts it, it's the Mac Daddy. It includes a lot of different blood screenings. It's a 28 panel blood screening, and A1C. Those 2 are included in baseline health, and they can get 1 package pass worth $10 off if they purchase those 2 together. If they want to choose the essential health package, that means they're picking blood chemistry, A1C, and then we've added on vitamin D for that one. They would get 2 package passes if they did those 3 and get $20 off. So the participants will then pay the cashier with their package passes and plus any other form of payment they need for the remaining balance. Here's a sample of what the package pass is going to look like. We're not quite sure if that's going to be white or colored. We haven't figured that out, but there's front and back. It explains the baseline versus essential health. The portions at the bottom are for the cashier to fill in. So don't worry about, as a volunteer, handing these out in the registration area. You don't need to fill any of that out. The cashier will take care of that. When they flip it over, you can see it's got an expiration date, a little bit more explanation about what the packages are. So there's the passes for you, and you should have volunteers in the registration area helping to educate and pass these out. It's a great idea. We'll go into some ways that you can get these out. Your screening package educator, or we shortened it since that's really long, the SPE will work side by side with your medical registration educator. We know sometimes people shorten that to registration educator or medical. What is it?
Regicator.
Regicator, that's it. So the SPE can work alongside the regicator and they can do it together. The SPE can go down the line for on-site or the walk-in registration. If there's a long line of people waiting to actually get their form and fill it out in the registration area, utilize that time to go down and talk to people while they're waiting. So that person can have a bundle of those package passes with the talking points that we put together in the protocol and be ready to help the participants make their decisions. They will have, as I said, a bundle of those passes. They'll come in your supplies. Utilize the protocol that's in section 7. That's the non-medical section, pages 14 to 16. I know some of our sites just want to get more medical registration educators to do this. You're free to do that. You can definitely do that. But if you can't get enough medical folks, then utilize this screening package educator. It can be a non-medical person to help people talk about what these deals are. And there is, we're anticipating some of the common questions. So there's a question and answer section in that protocol that will help those volunteers explain some of the common questions we think you're going to hear. Okay, so I won't go into too much detail here. You guys probably have heard that planning your fair can be so much better, so much less stressful, and you can have a lot of joy if you're working with people that you love being around, and you can take the load off of you if you have more team members working with you. So if you've got co-coordinators working together for the site coordinator position, non-medical position, or the medical coordinator position, that'll help spread the load as well. Publicity coordinators, volunteer coordinators are tremendous. So those volunteer coordinators can just help get out the logistics and really organize all the medical and non-medical folks. And then for publicity, you're obviously getting the word out about volunteer positions that you need filled, and for participants to know what's awesome about your fair. It's highly recommended that you have a publicity coordinator. We have been working with quite a few different universities and colleges to get publicity interns as well. And you guys are free to work on that angle if you want to approach any universities or colleges and try to get students to help out. You can also have training coordinators. That's kind of nice if you create zones the morning of your fair and you have training coordinators that are responsible for registration area, the lab area. If the lab supervisor needs a little extra support with training and helping new phlebotomists out, you can have that with the different medical screenings and, information booths you might have in your fair. So those training coordinators can really help spread your workload the morning of your fair. And then food coordinators. We like to spoil those volunteers that are coming and donating their time to you guys. So it's nice if you can have breakfast, beverages, and lunch in a volunteer break room. And that food coordinator can just focus on asking for those donations and not have to worry about anything else. This is a sign that we recommend that you guys have either in your volunteer check-in or your volunteer break room. It will really help to communicate with the volunteers that it's leadership volunteers that are doing all this work. We want to make sure these Day of the Fair volunteers are aware it's not 9Health Fair staff doing all the work, it's you guys. And they may like the opportunity if they don't realize it's a volunteer position or volunteer positions that are doing all this work and this great community service. They may decide, hey, I can do that, or I'd enjoy that. This might be a great thing for my resume, or I need more community service hours. There's lots of things that people like to do with their time, and sometimes planning events is one of those.
So 9Health Fair t-shirts are available again this year. The color has not changed from previous years. It is still a royal blue. So if you have a t-shirt in your closet and it's still in good condition, feel free to wear that. You will want to designate one volunteer to order your t-shirts and be in charge of that. We usually recommend ordering at least 1 week, if not 2 weeks prior to your fair date. Additional t-shirts can be bought for your day of volunteers or additional volunteers for $5 each. You will not have to pay at the time of your order. You will be invoicing later after the fairs have calmed down and we're back in the swing of things. And you will be able to get 10 free t-shirts once you have listed all of your coordinators and your co-coordinators in the fair management system so that we can know their names, their sizes, and all that stuff. So if you have any questions about this, you can contact your liaison. And if you feel you need more than 10 free shirts, definitely talk to your liaison about that. Vouchers for site leadership. So we want you to take care of your health as well as taking care of the health of your community. Each of your teams will be given blood screening vouchers so that you can get your blood checked as well. And if you need additional vouchers, you please reach out to your liaison. We're here to help you with that. Client services, Melody or Zali will send the vouchers to the site coordinator to get out to the rest of the site leadership teams. And again, please reach out if you want additional vouchers for someone on your team. You'll also receive vouchers for your community. So if you need help with getting additional vouchers, you'll want to email Terry at 9Health Fair, and that request is due by the 2nd of February, which is a couple of weeks away already. So you can request an additional 15 vouchers in addition to those 3 blood chemistry vouchers that you'll be given. For help creating a plan or knowing what to do with these vouchers and getting them out to the people and your community that need them, you can contact Virginia. She has a lot of really great tips. She's our community outreach specialist. She's been doing this for many years, and she does a tremendous job at being able to seek out those places and people who need and can be of benefit to these. So again, make sure you have your voucher requests into Terry by the 15th. And these vouchers are used for people in the community who otherwise would not be able to get blood work drawn at a 9Health Fair. And we really want to reach those people. So please ask us about that. We're continuing with online registration, and just a little overview. There's an online registration protocol in section 4 of the resource guide. So you will definitely want to check out the video for this and share this video, or have your day of volunteers doing this. Look at the video ahead of time. To start with, participants will arrive at your fair with a 2-page single-sided printout. We don't have a slide of that, but you can take a look at that when you look at the video. They will check in at the online registration table, which is separate from the day of registration, and they will need to get stickers to give to the phlebotomist to put on their lab tubes. So online registrants will skip by on-site live day of registration. They don't have to stop at form check, because form check will actually be completed when they get their stickers. And they also do not have to stop at cashiering. However, they have to stop and merge into the existing blood draw line. They don't get to cut to the front of the line because they're registered online. Some people may think that they can just go through with their mobile phone. I had this happen at one of my fairs, but you actually have to have that physical piece of paper because we need that for tracking purposes. So online registration volunteers, ambassadors, traffic volunteers, and obviously cashier and lab supervisors need to be familiar with online registration. You'll want to have extra copies of both sides of the form in case people print it out double-sided. If a participant has registered at another site and comes to your site instead, that's fine. Just go ahead and add their information to the exception report, and you will have copies of that you can make copies of to have at your fair. And your liaison will go over all of this with you too. So you want to have copies of the exception report, copies of the front side, the back side of the form in case someone does come in, they forget their form, they couldn't print it out. Hopefully those are rare instances, but just go ahead and be prepared for that. You will want to have extra staff for this. If you have up to 100 online participants, at least 2 to 3 volunteers, and over 200, I would have 3 to 4 volunteers. And you can have someone walking the line with a clipboard and witnessing those participants. And that way, when they get to the online table, all they have to do is get their stickers. They've already been witnessed, and it saves a couple of seconds of time, and it makes them happier when they see you coming down the line and getting them expedited as quickly as we can.
There's a couple of really good videos for you guys too on that May 9Health Fair page website, and then you go to volunteer training, like we were talking about videos before. So review those. There's one for coordinators and one for Day of the Fair volunteers. Really helpful to look at that.
Yes, and so here's another slide, and as you can see, you'll print the online registration report from your coordinator dashboard, and that is found in your fair management system. So the original system that you've been used to using, you will still access that the same way. And if you're new to the fair, we'll make sure that you know how to do that, because online registration does stay open until the minute before your fair opens, but you've got this, don't worry about it. You'll have extra forms there, you'll have volunteers working the line, and you'll have extra copies for anyone who's had difficulties. So do not worry about online registration. I know some people think it's a bigger deal than what it is. but you guys have got this. And don't let that long line intimidate you. We also have a new exciting participant dashboard. And as Alex said, Amy, our new employee of digital health, is here to work on that and make it even better. We're launching it really all over the spring this year. We piloted it a little bit and it went over well. Some of the staff have taken part in this as well. So if you want to learn more about it, which I would encourage, it'll be a great video for you to watch. You can go to the link listed here. So basically what it does is it shows year over year trends, and there's a copy of the results for your medical provider, and there's a copy for the participant that's a little more user friendly. It explains things a little better. It's in color. Who doesn't want color? Mm-hmm. And education is attached to each screening. And so basically, as you can see here on the hemoglobin, it's outside the normal range, and it'll give you a little explanation on that. And then it'll also give you tips on how you can work on that specific blood test result. It's really cool. We've come a long way with this, and the personalized education based on those screening results. It's a great thing to see.
I love the trending.
The trending is great too. Awesome. So you can see if you're doing better, worse, staying the same. It's quite amazing.
And you can get those discounts when you register online. This is all for people who register online. So our people that walk in don't get this dashboard. So the discounts that we talked about, plus this dashboard, there's so many benefits to registering online, and this is one of them.
Cashiering, one of the most important things at your fair. Cashier forms and supplies will be sent directly to your cashier supervisor. I think in the past they may have been sent to the site coordinator, but now we're sending them directly to the cashier supervisor. Obviously, you never want to send money to the 9Health Fair office. All currency is converted. You'll take funds out of the 9Health Fair income the day of your fair and convert that currency into a cashier's check. If you have any cashiering questions, please feel free to reach out to Terry. She's more than happy to answer your questions. So now we have a few reminders before your fair. Start planning. You've probably already done that since we've been bugging you to complete steps 1, 2, and 3 by tomorrow. And you will also want to decide what screenings you would like to offer by tomorrow. In order to do this, you go back to the fair management system and you will put your screenings in, and we'll talk a little bit more about that in a moment. You want to invite people to come into your health fair and help you with setup, tear down, day of. A lot of schools and clubs, they have the expectations of having to go out and be in the community and give back, and they want to be at 9Health Fair. It's a great place. We love our volunteers. And we really hope that you can reach out to people in your community to help you put on a great fair. You don't have to do it all alone. You too can reach out for many volunteers. You'll want to see the planning section of the resource guide. There's lots of great tips and tools in there. And obviously, when you're putting on a 9Health Fair, it does take equipment and supplies and food, lots of stuff. So you want to ask for donations. You want to have a volunteer who's very comfortable asking for donations, money, whether it's supplies, money, or food donations. Have someone who's willing to go out into your community and hit the ground running and ask for those donations. The worst thing they can say is no.
Okay, so here's some more kind of training and events that we just want to go over today. You're already listening to the Managing Your 9Health Fair webinar. We are going to have a posted recording of that on the volunteer training page of the main 9Health Fair website. You can also view a virtual model fair. We're not doing a model fair this spring, so you can watch the virtual option, or we have some other trainings. We have these medical and non-medical trainings that you can view. If you go in the volunteer management system and look under events, look for those medical and non-medical trainings. We have a staff member named Chantel. She is an instructor. She's a 9Health Fair guru and was a leadership volunteer for years before she became staff. She puts on those medical and non-medical trainings, and they're a great substitute for people that need that in-person live kind of vibe and flow of what goes on at a fair. before they run their fair. So check those out. We have other website trainings coming up, including lab trainings. There's going to be, I believe, 3 of them for lab supervisors, and then the volunteer management system one that we've already mentioned. If you guys need more support with that, reach out to the volunteer engagement team if you need more support with the volunteer management piece of it. You can see packing days there. Statewide is on February 18th. We'll be packing all your supplies before the guard starts delivering. And then for metro area, we're going to do on March 17th. And then your liaison will be in touch with you about delivery schedule. And Dave Quintana, we have his contact information later, is also useful if you want to know about your delivery schedule for your 9Health Fair supplies. And then you can see in nuts and bolts, we include these dates as well as just little reminders for you guys. Okay, so for signage, you guys may remember that we had razor flags at quite a few sites last year. I don't think quite everybody in the spring earned one. It was an incentive last year. So if you got your steps 1, 2, 3 done by beginning to, mid-December in 2019, then you earned this bright red 7-foot tall razor flag to use outside your fair. Well, we offered this again this year as an incentive. So if people got done with their steps in mid-December, then you could earn another one. These are really nice in high traffic flow areas. So there's cars driving by fast. It's going to be a lot more visible with this tall red flag outside, waves in the wind, and really gets their attention. Put it wherever you have, an entrance into your parking lot. You can put it close to your main entrance to let participants know where to walk in the front door. But we really want to emphasize that this is intended for outside your fair. We had some folks that used it inside their fair, and we really want those passerbys to benefit from this tall, bright red flag. So make sure to use it outside your fair. There are a couple of ways that you can weight this down. There are crossbars at the bottom with holes at the end of each of the crossbars, so you can use stakes in them, metal stakes. There's a water bladder that comes with the razor flag, so you can weight it down that way. If that's not enough and you're in a really high kind of wind area, put some sandbags on it as well, or if you have other ways you want to weight it down. These are your property. So you can see there, it's the property of the 9Health Fair site. So not 9Health Fair as an organization, but your site. So once you've earned one of these razor flags, it's yours to keep. We don't want it to get damaged in the kind of trucking it back and forth between 9Health Fair and you guys. So if you've got a basement, garage, they're really tall and skinny. So keep them upright and store them where it works for you guys. And I already said that it attracts participants. So put it in a high visibility area. One more piece of signage that's coming back this year is those coming soon signs. You guys may remember we sent these kind of flat sandwiched boxes with these coming soon signs. They're on metal stakes and meant to put in the grass. If you don't have a lot of grass around your site, you can tape them up on poles, on fences, outside of buildings. So there's lots of ways you can use them if you don't have a lot of grass that you're able to put these yard signs in. You guys can customize them as well. So right now everything is, 9Health Fair coming soon. But if you want to put your date on it, if you want to put an arrow on it, anything like that, that's totally fine. Make them your own. And they are intended for, if they're still in good condition, you can use them again. But if you wrote your date on it, then the intention is you get new ones for the next year after that. We don't expect those to come back with supplies, so you're either going to end up tossing them or store them, whichever works for you. And try to get those out early. See, it says 2 weeks before your actual fair date. The more people drive by them, they're going to get it into their mind. Okay, I'm going to go to that site. They're running a 9Health Fair. So the earlier you get it out, the better. Okay, more on local publicity. As you can see, it's key. If your community members know all the special stuff you're offering at your fair, they're more likely to remember it and stop by the day of your fair. So we'll show you on the next 2 slides. There is a local publicity checklist. This is a returning checklist. It's been really popular with our site coordinators and publicity coordinators. You can download that checklist right from the resource library. You can also see flyers, logos, and we're going to have a webinar for publicity coordinators coming up. We are going to do publicity nudges again. If you have a listed publicity coordinator or a publicity intern, then we'll send those nudges to them. If you do not, then it's just going to go straight to the site coordinator. So hopefully you can get someone else and it's not too much on just the site coordinator.
Another idea that has been suggested is reaching out to your local city council persons to include your fair in their monthly newsletter. A lot of churches, synagogues, or temples have a monthly newsletter as well, but they need to go to full press about a month before their distribution month. So a September newsletter would go into print about August 1st, and we're probably looking at by beginning of March, we'd want to get this in. So city council, your chamber of commerce, local rec centers, or any of that, you can reach out to them and they may be more than happy to advertise for you. And if you are in a district or in a region, you may want to think about adding all the fairs in your region so that you're co-advertising with the other fairs in your region or district.
Very good ideas. And we know you guys have unique ideas too. So as much as you can spread the word to community members and businesses. So this is the front side of that publicity checklist that I mentioned. And then on the next slide, here's the back. And it just kind of chunks it out into different kind of topic areas that you can focus on for your publicity plan.
So more publicity. You want to promote things that are interesting or new. And we have lots of new for you and interesting. We have the package discounts, which we talked about earlier with the passes, the baseline health and essential health. We also have the dashboard and any new blood screenings we have, which this year we don't have any new blood screenings. We still have, we're still going to offer blood type and HSCRP. We added those, I think, a couple seasons ago, and they haven't been overrun yet. So we're going to keep offering those. Your optional screenings are a big thing that you want to advertise because people will be drawn to your fair for specific screenings that other fairs may not have or may not be able to offer. Some people go to several fairs to get all the screenings they need. So they may attend your fair for the blood screening and the breast exam, but they may hop over to another fair to go and get the pap smear exam or whatever it is. You can also advertise 9Health e-tools, and there's the link for you to get more information about that. And of course, we always have education organizations that will want to attend your fair. We have a list on our website of IECs that are approved by the 9Health Fair. And we also may receive calls or emails from IECs or total wellness zones that are interested in your site. And if we do get those calls or emails, we will be communicating with you about those folks that want to be at your fair. And your liaison or someone else from the organization will let you know about that. And again, these are optional. We have an entire new section in our resource guide, section 13, that discusses the total wellness zones and the IECs. If in doubt and you have any questions, just ask your liaison and go ahead and go to that approved list on our website and seek out the organizations you want, and many of them will love to be at your fair. So you want to partner up IECs. So if you're having breast exams and pap smears, you may want to have a women's health connection there so that they can talk to these subjects and help women and participants get the resources they need after the fair, or just give some more education because the screener may not have time to do all that education because they're doing the screenings. So we all know we're in the social media era, and people love to see things on social media. Some people love to see it in the newspaper as well. So feel free to get on Instagram, Twitter, Facebook, and remember to tag us if you make a video or if you create any pictures for social media. You just use @9HealthFair and we'll go ahead and share your content. Make sure you take lots of pictures of your fair site. You can make a video with your team, or you can also do a blog if you want. And we have resources here, our social media team. Stephanie will be back soon, ready to go, and she can help you with all of that and how to make the video extra exciting, because people remember videos and they also trust the 9Health Fair 9 News brand. So just reach out to Stephanie in our marketing communications department and she can help you with that. And she may even end up at one of your fairs making a Facebook Live video. So, which is another thing you all can do as well.
It's exciting. She does really well at those.
She does. So we talked about 9Health e-tools, which is a suite of free evidence-based virtual tools. We want to be more of a year-round prevention partner, and we want to empower people to own their health all year long and not just be a 9-day event for a lot of people, even though we all know it's longer than 9 days now. So we have programs for quitting smoking, mental health support, just general healthy tips, and we also have a cardiac risk health disease assessment and building healthy social supports. That's from the National Institutes of Health. I suggest you guys go in and take a look at this. We've had a lot of traffic on the mental health support. We can take online anxiety or depression screenings, and we also can connect people who take those screenings, confidential of course, to free licensed therapy. As we all know, there's a huge need for mental health in addition to physical health. So you want to have information about that at your fair. You may even want to have a booth about it. Just let us know, and if you need any help with that, Amy is here to be able to help you with that.
Okay, so I think we mentioned site grants a little bit before earlier, but we want to make sure you guys understand what they're for. So sites will receive funds based on your participant numbers, and there's no application needed. All of them are at least $200. And they'll come straight to the site coordinator. If your site grants are 500 or above, you will receive some additional kind of paperwork, and client services will work with you on that. So we also can work with sites on increasing it if there's specific needs. So you have extra janitorial services or whatnot. We do have limits, of course, as a nonprofit, but we'll work with you best we can to get you all the support you need. Of course, we want to try to ask for donations and stuff so we don't have to do all the funding of it. It's just tricky as a nonprofit. So we want to make sure to come up with as many solutions as we can to support you guys financially with everything you have to purchase. Use these funds to support your volunteers and purchase items related to running your fair. So there's all kinds of things that might be. It might be tablecloths, it might be paper goods, it could be food for your nourishment station right outside the lab area where you have juice and crackers. If you've got extra, it can be for that breakfast and lunch. We do want to make sure that you save your receipts for what you're using these site grant funds for, and we're going to reconcile those expenses with client services after your fair is over. Instructions on that will be included when you receive your site grant money. And then supplies, we've got a couple different supply slides coming up. 9Health Fair screening and station supplies. The number will be determined by what you enter in the fair management system. So if you don't enter anything, we're going to go by the numbers. If you're a returning site, we go by the numbers that you entered from the previous year. But get those in there. Those are actually due by tomorrow, January 31st. That's Friday, tomorrow. So we want to make sure you guys get those in. If there is a high number of, people doing skin screening or breast exams or whatever it may be, and we don't have enough supplies, we need to know that early on. So get those screenings and stations entered. We also, our website is going live for all participants and volunteers on February 3rd. So that's another reason to have those screenings in there, because your participants want to know what you're going to offer. And shoot for the moon. If you guys are not sure if you can get a screener or not for one of your medical screenings that you'd like to offer, put it in there. We'd rather have the supplies for you, and then you can go and turn it off later if you didn't end up getting the medical person to run that. Make sure that when you receive the 9Health Fair boxes from the guard, you inventory those supplies right away and let us know you have everything you need. Because if you don't, we want to give our staff, your liaison, district leaders, enough time to get you what you're missing. 9Health Fair, again, is going to provide all the basic protocols and tally sheets. You'll have an envelope, a manila envelope filled with those. But if you need the optional screenings, they're in the resource library. So you've still got to print the optional ones. Okay. So for lab equipment. We're going to talk about lab for a second here. You're going to contact Melissa Dye at Quest, and you can see her phone number there. And she will help if you're missing anything or you have questions, you need more gloves, anything like that. Let Melissa Dye know, and she'll help with anything related to the lab area. Supply delivery from the guard, those members will contact your equipment and supply coordinator. That was in step 2 in the fair management system. So if you want to go in there and double check your step 2 that you've got the right person with the right phone number, it's really important that the guard can get a hold of that coordinator. If they can't get a hold of your equipment and supply coordinator, they're going to contact the site coordinator. If you have questions about the supplies from 9Health Fair, you can contact Dave Quintana. He is our manager, our warehouse manager, and our building manager here at 9Health. And you can see his cell phone number there is 720-987-9855. It's great to text him too. If he's running around at the warehouse some of the time, he's not sitting to answer a phone. So give him a text, let him know your name and what site you're with, and he will get back to you.
So a few important things for the lab area. Lab supervisors must be supervising and looking over the lab at all times and not drawing blood. I know sometimes lab supervisors love to help out. It's busy, the lines are long, but we really don't want them drawing blood because they need to be supervising and making sure all the other phlebotomists and the centrifuge people have what they need to do their jobs adequately, and they also need to be ready if someone were to get a biohazard exposure or a needle stick were to happen. All of our phlebotomists, volunteer phlebotomists, must wear gloves. It's mandatory policy. If they are palpating the vein before they are drawing the blood, that's okay to do without gloves, but as soon as the needle goes in their hand and they're actively drawing blood, they have to wear gloves. If they refuse to do so, you will need to dismiss them kindly from drawing blood at your fair. Again, we're going to have the colon cancer fit screening kits. A heads up, you should dispose of any expired kits you have in your basement or garages. If they're going to expire within 6 months, also dispose of those because they get circulated out to the participants and then the participants send them in, and they're invalid, they can't be processed, and then they either don't get their valuable colon cancer screening test that they've actually done, they get frustrated, they don't send it back in, or we send them another kit and it still doesn't get done. It's just discouraging to them.
Kat, could you call the lobby? Kat, please call the lobby.
We are also wanting you to write 9HF on the inside tear flap of the yellow return envelope. In the past, you had to write the extremely long site number. You no longer have to do that. If you want to, you can have someone at your site create a label that just says 9HF and have the volunteer stick the label on the inside flap the morning of the fair. It does need to say 9HF so it gets processed correctly under 9Health Fair's account. Day of your fair. Here we are, the day of your fair. If a screening is changed or canceled, if a screener can't show up or the line is too long and you have to close the screening early, you want to update your website screening list, and you'll do that on the fair management system. You can also contact your liaison, who may even be at your fair, or another staff member. You can also let us know at 9Health Fair. We will get our hotline number out to you. Probably it'll come out in nuts and bolts.
I think what's the main 9Health Fair number? We got rid of a separate 9Health Fair hotline number a couple of seasons ago. So just call it 303-698-4455 and we'll make sure to take care of you guys.
Clearly, I have not used the hotline myself. On-site registration form. As you can see, everything in yellow is mandatory. You'll see a little signed authorization received box on the left lower side next to the yellow. That's because that authorization form that we launched last year, I think, it's not mandatory. We had it in yellow last year, which looked like it was mandatory, and it wasn't mandatory. So thanks to the leader that caught that, and our apologies for that. The signed authorization form we're going to go into in a little bit here. It will reflect what it's actually going to look like. So we're going to go to the next slide now. Sorry about that. The authorization form, if it's signed, it provides 9Health Fair to be able to share personalized information to the participant that signs that form. So the way I take this is if I were to go into the fair and I sign that form and I get a high cholesterol reading, I'm going to get personalized information saying, Kimberly, it looks like your cholesterol is high. What does that mean? Here are some things you can do. And also if I've registered online, I'll see that information in the dashboard as well. So the two kind of work together to give you a little bit more personalized information. This year, on-site online registration will no longer have to worry about getting this form signed because it's built into the online process. So they will have already completed this online if they've registered online. So again, it allows us to inform participants of other new things, new health programs, new e-tools we may have come up with. So make sure if they sign that form, that checkbox is on the participant registration form, that it is checked. And if anyone does not want to sign this, absolutely, they do not have to sign it. If they do sign it, they retain the original copy, the white copy, and a form check volunteer will take the carbonless, the yellow copies, and the signed forms will be put in a white pre-marked envelope for the signed forms, and then they'll be given to the cashier supervisor at the end of the 9Health Fair for return to 9Health Fair. And here's what the form looks like. And on the top, you'll see marketing authorization form, and sometimes that can kind of throw people off. So again, it's for that personalized educational opportunities, new information based on their results, new programs we have. It's not that we're going to be marketing to them. Mm-hmm. We're not selling anything.
One other thing that I like to point out to our participants, just learning about this particular form, is that it's only tied to one blood screening. Mm-hmm. So if you come back season after season, we have to ask you again if you would like us to communicate with you about your blood results. So we can't just keep calling you and contacting you and emailing you about that, all your results. You have to agree each time you come in to get your blood work done. Do you want us to provide you with more education? And right now, Kimberly and the other nurses, we have the staff nurses and volunteer nurses that come in and make phone calls about critical and alert values that they see in the participants' blood work. But everybody else doesn't get a phone call. You don't get that extra education. So if people sign this, it's a great way to make sure you're really well informed on what happened with your blood work, what's going on. Are there any trending towards, things that are concerning? So yeah, it's only tied to one blood draw though. So just know that it's not forever and ever.
Okay, so we've touched on this already. And the next slide as well. Again, online, it's going to save that a few more seconds this year, so we don't have to explain the authorization form to our online participants. We will again have exit surveys. We get a lot of really great feedback. People love you guys. They love coming to your fairs. You want to have someone outgoing to do the exit survey. So just make sure you have someone at all of your exits if you have multiple exit locations. These were packed yesterday, as a matter of fact, and they'll be delivered with your 9Health Fair boxes from the National Guard. You'll use the checkout volunteers to help with this. And sometimes I've noticed high school children, they love to do stuff like this if they're very outgoing. And there's a puppy on the magnet, so you could always lure them in by saying, hey, would you like a free puppy? And we also encourage you to tell them about the fair, why we need this, because we want to be invited back to the community. The volunteers need the feedback. 9Health Fair needs the feedback. It can help us gather a little more data for grants and donations. And again, really, we want to be able to come back to that venue. So being able to show the venue how appreciative the community is a huge help for us. Exit surveys will be returned to the 9Health Fair with your supplies or to any 9Health Fair staff member who may be at your fair. My favorite, just in case, accidental needle puncture biohazard protocol. The first thing you're going to do if someone has a needle stick is someone is going to be designated to call the 9Health Fair nurse immediately. at 303-588-0093. Please put that in your cell phone. This is not if you run out of supplies or anything like that. This is for needle sticks and any other emergent medical questions. You have to call us right away. If someone is transported to an urgent care or an ER from your health fair, go ahead and get them stabilized and then call us. But with a needle stick or a biohazard exposure, please call us immediately. We will make sure that the participant is followed up with. You do not have to do any of that. So again, very important that you call us, keep that in your phone, and you want to make sure your lab supervisor, medical coordinator, site coordinator, everyone has access to that phone number. And the accidental needle puncture biohazard protocol, you want to have copies of that on hand at your fair. That way nothing will happen if you have those copies, and you can find those in the resource guide. For cashiering issues, you'll contact Terry, and any online registration issues, you'll want to contact Melody first. And then if Melody isn't able to get back to you, Dane will be more than happy to help out.
Okay, so tips to help run a smooth fair. There's a couple on here that we want to focus on before your fair, and then some are suggestions for right at your fair. We want to make sure that you guys are assigning your volunteers and you have them in positions before your fair. We've seen some of our leaders that like to just gather medical and non-medical volunteers and then assign them the morning of. We find that this creates a little bit of chaos and anxiety in some of those day of the fair volunteers. So the more organized you can be ahead of time, it will make their experience a lot better, and they're going to want to come back and help you year after year. With the new volunteer management system, they are picking what position they want to be in. So that'll be really helpful. If you utilize that system to register your volunteers, they're already going to be placed in a position. And next, email reminders. So we've got those automated email reminders set up in the volunteer management system, but it's not going to get at all the details for your logistics for your fair. So if you want to send your volunteers details about where to park, what to wear or not to wear. So like for lab area, no open-toed shoes. If you want them to wear their scrubs, are you offering breakfast or lunch? All those details to make sure your volunteers are ready and they know when and where to come to your fair. Check with the participants in line. So these are where we switch to day of the fair. If the participants seem like they're struggling at all, you've got someone that looks like they're exhausted or they physically don't feel well, and they've been waiting in line for a while, you may want to offer them a folding chair so they can sit. If you've got little cups of water, or if they have a water bottle that's empty and you want to refill it for them, it's just nice ways to take care of your participants, and they'll remember those little things, and that'll reflect in those exit surveys about their experience. You can also assign volunteers as placeholders. If you've got extra non-medical volunteers that want to help out, they can be placeholders for your participants in line if they need to go sit somewhere else. Something for your online registration, and this is the same suggestion we were making for the new package educator. If you want to have people with the clipboard, and I know Kimberly was mentioning this too, have people go down the line, and they're going to have that hard surface, whether it's a binder, clipboard, they're going to write in the hours fasting on each of the online registration forms. They're going to have the participants sign, and if they're 18 or older, they can be the witness right there. Before they get to the online registration tables, they've checked off several things. They have to check in there to get their stickers, and then you send them on to the blood draw area. This will keep that line moving nice and fast. People want to get through online registration quickly, but I will also make note for you guys. Tell those participants the benefit is not getting through the line quickly. It's getting their results faster. So it comes to the online dashboard faster than the people get it in the mail. So it's 1 to 2 weeks if they do it online, 2 to 3 weeks if they register in person. And then the other huge benefit is the dashboard. So that dashboard that trends year over year that Kimberly talked about earlier, those are the benefits now of online registration. Okay. So now we're going to go to what goes where after. I'm not going to go into detail here. We just want to point out one of our wonderful staff members and longtime volunteer, Lynn Sunshine, made these beautiful spreadsheets of what goes where after your fair. And there are 5 categories on statewide and 5 on metro. The details are different, so make sure you're looking at the correct page. So this is in section 4, the equipment and supply section, page 7 for statewide, and then it's for metro area, section 4, page 8. Again, there's those 5 sections. You can see there's a note at the bottom of both of them that if you have extra gloves or gauze that have been opened, you can donate them to your local community clinics that need that kind of stuff, or school nurses, whoever you think is in need of those kinds of extra things. We can't send them back out to the fairs. We also can try to make donations as well, but just know you don't have to send those opened packages back. Okay, do you guys have any questions for us today?
I'm going to jump in here and say we had a great idea yesterday from a volunteer to encourage your volunteers to bring their own water bottles and to bring their own coffee cups. Mm-hmm. So that's a wonderful idea for our environment, and if we can do so, that is great.
All right, we don't see any questions coming in, so we're going to wrap it up today. Thank you so much for joining in to our Managing Your 9Health Fair webinar, and we will post this on the 9Health Fair website for you guys to view later and share with your other coordinators. Take care, everybody.